Hi everyone, Shannon Petrovich with Therapist Talks. Today we're talking about depression, and since it's such a big topic, I've divided it into two videos, but I'm publishing them both on the same day so that you can have all the information at once. This first one is going to be Depression Decoded, which is all about the diagnoses. Why does depression happen? How do you know if you have depression, and should you be on medication? Do you need a therapist, a psychiatrist, or both? These are questions I run into all the time. In this video, we'll talk about how to know if you may have depression, what to do about it, when to seek help, and what kind of help you might need. This is not to diagnose yourself, or even worse, to diagnose someone you love, nor to be in place of getting help, but perhaps to alert you to the need for professional help if these criteria fit. Depression affects 16 million people in our nation, costing $80 billion in lost productivity every year. Globally, more than 300 million people of all ages suffer from depression. Depression is the leading cause of disability worldwide, and according to the stats, about 70% of those who are depressed are women and 30% men. Depression is really confusing because we all feel down sometimes, and we even go through major stressful events. A cancer diagnosis, the loss of a loved one, a catastrophic event of any sort. Sometimes this causes depression, and sometimes a person comes through it without any depression. Sometimes depression comes out of the blue and hits us like a freight train with no apparent trigger. The Diagnostic and Statistical Manual, I know, it's just a current manual for mental health diagnoses. All it does is list the symptoms and give you the diagnostic criteria so that when your therapist or psychiatrist goes to bill, they know what it is. So for at least 2 consecutive weeks, you must have 5 of these symptoms. It must include a depressed mood, which means you're sad, tearful, empty, feeling hopeless pretty much all the time, or a loss of pleasure, you're not interested in the things that used to bring you joy. And 4 more symptoms from this list. The first is a decrease or increase in appetite with significant weight loss or gain, meaning 5% change in 1 month. Insomnia or hypersomnia, meaning you sleep all the time or you don't sleep at all. Agitation or retardation, which means that you're super agitated or you can't get off the couch. Fatigue and loss of energy, feelings of worthlessness, excessive guilt, and diminished ability to think. And the last one is recurrent thoughts of death. So this can be a passive thing or it can be an intentional thing with plans. So to backtrack a little bit, a depressed mood or a loss of pleasure in things, plus 4 more symptoms from the list. Appetite, sleep problems, agitation or fatigue, loss of energy, feelings of worthlessness, diminished ability to think, and thoughts of death. So these symptoms have to have caused significant distress or impaired functioning in your social, occupational, academic, and other areas of functioning. And they have to not be attributable to physiological effects of a substance or a medical condition. In other words, if you are laid out on the couch all day because you're on drugs, that does not that's not a depression. If you have a medical condition that laid you out on the couch all day, that's also not depression necessarily. So we also have to sift out those major stressor events that I talked about, the loss of a loved one, a serious diagnosis, a catastrophic natural disaster. It's totally normal to have a grief episode lasting 6 to 8 weeks after a particularly severe event. So that doesn't necessarily mean you have a depression. Depression can run the range from mild to moderate to severe. The more symptoms that you identified on that list, the more severe you are. The severe can also include psychotic symptoms such as auditory or visual hallucinations. If you have depression, it means that the chemistry in your brain has taken a significant shift. This is an illness like any other illness. It happens to be in the brain, and it needs treatment and should not be stigmatized. So let's back up a little bit to what's going on in the brain. The natural brain chemistry has checks and balances. When we have stress, adrenaline and other stress hormones course through our system that gives us the drive and the energy to deal with that stress. Then the serotonin and other happy chemistry, neurotransmitters, are supposed to balance that out. We're intended to relax and process each day at the end of the day, recharging with loved ones, sleeping, eating, when our homes, in order to have that happy chemistry, put a lid on and calm down that stress energy. But when our homes are stressful, our homes are not rejuvenating, when we don't eat or sleep well, when our lives are chronically stressful due to being constantly on at work or at home, or not having other ways to rejuvenate, we literally wear out this ability to put that calming lid on it, and eventually we deplete our brain chemistry. When the serotonin and all that other happy chemistry is overwhelmed and depleted, that's the definition of depression. So unfortunately, in our I want to feel better right now culture, we also add insult to injury with some of our crummy choices. Alcohol is a depressant drug, and not only adds depressants to our system, but it depletes the happy chemistry further. Other drugs, illegal and over-the-counter, and prescriptions can also deplete our brain chemistry and can have depression as a result. Poor nutrition, lack of sunshine, lack of exercise, all of these things deplete us further. So depletion of the happy brain chemistry is the problem. What's the solution? Once the brain chemistry is depleted, it's really difficult to get well without an antidepressant medication. But for various reasons, I've known plenty of people who refused to take meds and still got well. So it's not impossible, just hard. And since all the meds have side effects, this is not to be taken lightly. It's a personal decision made by you and hopefully in conjunction with your doctor or psychiatrist. So the medications generally assist the brain in replenishing the serotonin and other positive neurotransmitters so that gradually over the course of usually several weeks, sometimes months, you begin to feel better. All the meds have side effects, like I said. So in the next video, I'll talk extensively about the entire list of coping strategies to help you get better naturally. If you want to get well without meds, you'll have to really step up to the plate, especially if you have a more severe depression. If you need medications, you need a psychiatrist in order to evaluate you, prescribe that medication, and continue to check in with you as you get well, or to change the medications to help you. This is an art and a science, and it often takes a lot of adjustment to get the right medication at the right dose for you. In some areas of the country, maybe even many areas, I know it's nearly impossible to find a psychiatrist. And sometimes a primary care physician will be willing to help manage this with you. This is not ideal as it's not their specialty, but it's better than not getting help. So if you can't get a psychiatrist, talk with your doctor. Most health insurance plans have a list of people they refer to, so call your health insurance carrier or get online to find their provider list. There are also community mental health services in most areas, so look into that if you don't have insurance. This is really important. You wouldn't treat a broken leg yourself, so don't try to go this alone. You also need a therapist to help you with the stressors or grief or trauma that may have instigated or exacerbated the depression, and to learn coping strategies to help you get through this and prevent a recurrence. Your therapist will help you work through what happened, help you process and integrate it in a healthier way. Don't go it alone. Even if you currently have mild depression, it's important to realize that without help, you might continue down that path towards a more severe depression. So in summary, depression is a serious illness which demands serious help. Don't take on any stigma and don't support stigma around for those who you care about. The shame that goes with depression and the difficulty getting help is part of what drives hopelessness and suicidality. If someone you love is depressed, help them walk through the steps to get help. Being paralyzed and feeling hopeless and overwhelmed are part of the illness. They're part of the symptoms, as I mentioned. You wouldn't expect your loved one to get herself to the doctor if she had a broken leg. Seek a psychiatrist if possible, or your doctor if not. Find a therapist to help with coping strategies and processing the stressors in the healthiest way possible. Again, the suicide prevention hotline number is 800-273-8255. And in my next video, that will be about the specific coping strategies that you can use to help yourself get well and stay well. The next video, as I mentioned, it will be called Depression Critical Coping Strategies. And it will be a vital resource, so please watch that one as well. I've put them out separately but on the same day to help you do everything you can to help yourself with a depression. If you appreciated this video, please hit like and subscribe, leave a comment or question or suggestion in the comment section, and thank you for listening. I'll talk to you again soon.